Hello, my name is Daria Rogers. At the start of this year, in January 2024, I was diagnosed with the cancerous brain tumor, glioblastoma type 4. It's aggressive brain tumor following a brain surgery that happened to just occur following an incident that I had, like a brain seizure, and I lost consciousness. And luckily I survived that incident and the surgery, but unfortunately the diagnosis was very grim. It was glioblastoma type 4 and a recurrent disease. So we were shocked and devastated at the start of this year. And I suppose my husband, Maurice, then started investigating and researching what else was available, maybe outside of the country where we live. We live in Ireland, to see what else could be done in terms of helping me to live and to survive.
With Daria's condition, with glioblastoma, there's very few options outside of our home country. The diagnosis was it's glioblastoma. It's a recurrent disease, and regardless of what we would do, even in terms of a successful surgery, that the cancer would return and it would continue to grow. So for us, we had to look internationally. We looked at the science, we looked at the disease, we looked at the studies that were conducted on glioblastoma. And everything that we looked at led us back to Germany. Originally, there was studies by Professor Steinman in Canada with dendritic cell immunotherapy. But out of that, there was a lot of work being done in Germany on that treatment, on the immunotherapy treatment. But the dendritic cell treatment itself, it was a very simple concept for us. Like, we were very upset, obviously, and traumatized when we got the diagnosis for Daria. But the concept was that it uses your immune system, your own immune system, your dendritic cells, extracting blood, bringing it to the laboratory, training it to identify the code of the cancer, the antigens of the cancer, reintroducing the trained immune system back into your body and letting your body fight the cancer. So it would identify it normally. Cancer is, your immune system doesn't see cancer. It's immune. It's invisible to it. But in this case, the whole concept of the dendritic cell treatment for us made sense. And the doctors like Professor Gonzoghi and the LDG laboratories in Germany, they were definitely the world's leading experts in dendritic cell immunotherapy. And Booking Health were the agency, the company, the kind of the conduit that could bring us, that could assess Daria's medical files, and then introduce us to Professor Gonzoghi and his clinic. We were just very lucky and very fortunate, I guess, that Daria's specific circumstances around her age, her tumor size, the location, because the surgery was actually quite successful. It removed what's known as a full resection of the tumor mass. So in that sense, it was very successful for surgery. We were very lucky, and we were accepted by Professor Gonzoghi in the clinic. But ultimately, it's not invasive. The procedure itself, the whole concept of it, it's very non-invasive. There was no side effects that we saw, none whatsoever. It was just to visit the clinic, an extraction of blood. The blood was taken to the laboratory. The whole process around live culture, the new techniques that are there now available very, very recently only, and it's only actually with Professor Gonzoghi's clinic that they have this technique. It makes it applicable for glioblastoma. The data that's behind the science is there to a degree. So the dendritic cell treatment, it's a very positive experience for us. There was no side effects, as I said. There was no major issues for us to do this. The real issue was just to get to the clinic. We were lucky that Daria was in a well enough condition after her surgery, her craniotomy, the brain surgery, the removal of the tumor. We were lucky. It was only 3 weeks after. the surgery, we were able to get on a ferry and travel across from our home country in Ireland to France and drive ultimately to Germany. We could have flown, it turned out afterwards, but it's been a very positive experience. Yeah.
As we've already mentioned, I had a full, I had a brain tumor removal, which was a successful surgery in that sense. So I spent about 2 weeks, no, just over 2 weeks in the hospital. Well, actually, nearly 3 weeks, and we straight away went to Germany for immunotherapy. And when we came back, I started radiotherapy combined with chemotherapy tablet form, pretty much straight away, maybe just a few days after we came back. But I can absolutely say that the dendritic cell treatment definitely helped me to go through the standard treatments, to go through the chemo and radio, because I remember I had energy to go to the clinic 5 days a week, actually tolerate the treatment without any major side effects. Yes, I had an odd headache, or I probably felt a bit nauseous, but I was able to go through it. And I believe it's because of dendritic cell treatment. My body was also infused with various vitamins, including vitamin D and vitamin D injections, which accompanied the dendritic cell treatment, and that just definitely helped for me to stay kind of strong throughout the treatment. The treatment itself was fine. I was lucky again, I suppose, that radiotherapy didn't affect any of their of my I don't know, vision or speech or any functions in the brain, or my day-to-day functioning. The only major side effect was probably tiredness, but I suppose that, considering everything, that would take time. So dendritic cells, it kind of practically, it was a very simple treatment. Basically, blood was extracted from me. I got some vitamins through my injection, through the vein, intravenously, and I was waiting for a week until Dr. Ganzauge's magic team worked in the laboratory and created the specific injection vaccine for personal vaccine for me. So.
But ultimately, I think that the treatment in our own country, the surgery was excellent in Dublin. It was really, really good by a super team of doctors. So we were very lucky, even though the diagnosis was really bad, and they couldn't the glioblastoma multiforme is a horrendous disease to have. It's a terrible situation. Once you're diagnosed with it in the standard system here in our own country and in Europe in general, and in the world in general, you have a time frame to live, basically, and that averages between 12 and 15 months. So the surgery was good in our own country. The follow-on treatment, the radiotherapy, chemotherapy was well done and reasonably well tolerated by Daria. But ultimately, the diagnosis was that your life was coming to an end, and that you only had a particular window of time left, and the treatment would only slow it down, and it wouldn't obviously fix you. But with the treatment in Germany that we did at Professor Gonzoghi's clinic, the dendritic cell treatment, that gave us real hope. We read the science, we understood very clearly what the situation was with the disease, but we also understood the data and the techniques and the concept of immunotherapy. We understand it's used widely in different applications outside of glioblastoma, but the whole concept of what we did there was very simple. There's a lot of names, there's a lot of techniques, a lot of procedures, but ultimately you go to a clinic, you have your blood drawn, if you're suitable, and you have your blood taken to a laboratory, it's reintroduced to your body, your body's infused with various vitamins and different things like that, which is pretty straightforward. and you go home and you wait for the results of the scans. So ultimately, Daria had this tumor removed in January this year, 2024. We had radiotherapy. Sorry, we went to Professor Gonzalgi. We had the dendritic cell treatment done. In terms of a timeline, we had surgical removal. We had the dendritic cell treatment completed 3 to 4 weeks after the surgery, we were very lucky that we did that, because it's always more effective seemingly. The earlier you do anything, the better. She did it on good bloods. Then she had the radiotherapy, the chemotherapy, and 3 months after the end of the radiotherapy, we had an MRI scan, which we were very anxious about, because that was quite a significant time after the surgical resection, and we weren't sure, but the scan came back crystal clear. So it was just a cavity of where the tumor was removed. There was no other evidence of cancer, glioblastoma growth, which would be very unusual with that disease. It's like, I'm not a doctor, Daria's not a doctor, but we know that it's not normal not to have evidence of it in there at that stage. Subsequently, we did an additional scan only a couple of weeks back, just back in October, and that also was crystal clear. So the MRI scans that we've got this year and only up to a few weeks ago were crystal clear. So Daria, she's overcome the chemotherapy, radiotherapy, which are very difficult, even though it's a tablet form and it's not the intravenous type chemotherapy. She overcame that. And we have a scan now that shows crystal clear. And that's remarkable. We never would have expected that. We knew going to Germany with the science that was behind what Professor Gonzalgi and the clinic offer with the live culture process, we understood there was very unique characteristics with the treatment that they offer. But ultimately, we have scans, MRI scans now, that show Daria's crystal clear, absolutely crystal clear of any form of cancer. And again, with glioblastoma, that's completely not normal. And it's only the dendritic cell treatment could be responsible for it. The traditional standard treatments in our country, radiotherapy, chemotherapy, they cannot do that. You cannot get those results with that treatment. We're coming up to a year, nearly, you could say, next month, for when she had the glioblastoma, the multiform within the cavity of her brain. It's gone now, and we have scans nearly coming up to a year later, crystal clear, and that's a direct result of the dendritic cell treatment. There's no question.
Yeah, absolutely.
Yeah.
And the moment, I suppose, we met Professor Gonzalgi, we felt a lot of we felt a lot of empathy, a lot of very warm atmosphere from him, Dr. Gonzalgi, and all his staff, his team, and it gave us great hope. I must say that I wouldn't have been here sitting right now talking to you if it wasn't for dendritic cell treatment, because unfortunately communication post-surgery and once you go throughout the standard treatment and is not great in our home country, because nobody kind of knows.
Well, you're terminally ill. Yeah. Once you have glioblastoma multiforme, you're treated as a terminally ill person, a person whose life is coming to an end. The time frame of when your life will end will depend on your tolerance to the chemotherapy, the radiotherapy, the size of the tumor, how many tumors you have, the location. There's a whole quantum, a whole multiple that has to be added up. But definitely Professor Gonzalgi, once we met him, he spent quite a lot of time explaining to us the disease, the actual disease. We didn't have to read it on the internet. He explained to us the disease. He explained to us the realities. There was no ambiguity around the situation Daria was in. There were no false promises. There was nothing like that. It was a very straight conversation, but the science behind the treatment that's there, the data that's coming out, that was explained, and we took great hope from that at the time. And I think we both knew once we left Germany and we were returning to Ireland, we went in desperation, really. We went in absolute desperation and brokenhearted, but we came back understanding that what we had done was the correct thing. And right now, 10 months, 11 months on, you could say we have MRI scans showing crystal clear, no evidence of any growth or progression of any type of cancer whatsoever. So the treatment worked. It will be monitored with MRI scan every 3 months going forward. Daria will be scanned every 3 months going forward. But we're very hopeful. We keep a close eye on it. If we have to get a top up of the treatment down the line, then we'll do that. But right now we're in a really good position. We had no hope and we were desperate, but following the treatment, the dendritic cell treatment and the overall treatment from Professor Gonzoghi and LDG Laboratories and the follow-up in the background, I think there's hope. I think we're in.
Well, and it's a confidence as well that came through that Professor Gonzoghi and his team, and basically it's a will to live, it's a will to fight the disease. It was all very kind of quite evident, and a lot of warmth and empathy, something we haven't encountered before.
And we would say to anybody, like we would say to any person and family that are dealing with what we've dealt with this year, and it's been a very, very difficult year for us. It's been terrible. That if you are dealing with your own in-country medical services and your own in-country doctors, and they give you the diagnosis, don't lose hope and don't give up and don't fall apart. Don't do that. It's a very aggressive disease, but there are treatments there now to deal with it. Right now, today is very different than it was, say, 3, 4, 5 years ago in terms of the science. That's there. There are new techniques. There are these live culture techniques. They make it very applicable for glioblastoma. Daria has 2 clear scans, as I said earlier, showing no evidence of cancer. It can only be because of the dendritic cell treatment. There's no other way that could have happened. So there is treatment there for you if you have glioblastoma. I think our advice, and this would solely be from our experience, you need to go early, go very quickly and go early. It's better probably to do it before the radiotherapy, chemotherapy, I think. It's better to do it before, like all treatments, even in the detection of cancer, the earlier the better. Go early, do everything you can do to get it done immediately, that dendritic cell treatment, because in Daria's example here, it does work. It's worked for us so far. And we're in a good position maybe to get a top up down the line, who knows? But yeah. Originally, when Daria was diagnosed with the glioblastoma, the diagnosis was really bad. It was a terrible situation. So we were very, mentally, it's a very difficult thing to do anything, even just to do the basic functions in your day-to-day life. We found it very, very difficult. So what we did was we researched the science behind what we could do to try to help against glioblastoma. And the portal that brought us to the largest amount of detailed information was Booking Health. So once we contacted Booking Health, we read up on the disease, we read up on the new techniques, spoke about Professor Gonzoghi. We reached out via the portal, the online portal, to make contact. And very quickly, we got a response from Kate. Kate was the main agent that we dealt with. So from there, it was about obtaining Daria's medical files from the hospital, because she was still in hospital at this stage, just post craniotomy, the surgical removal of the tumor, was to get Daria's medical files, surgical notes. That was the first step. Send it to Booking Health, to Kate. There was a review by the professional team of doctors that Booking Health have on board. And then they gave a recommendation of where was the best place to go for treatment. And this was all very straightforward, very simple. It was very quick. The responses were very quick. They were very clear. At this stage, we were very upset. We were traumatized. We could barely deal with, as I said, even to brush our teeth and to, make a cup of tea and stuff. Even when we were in the hospital environment, it was impossible. Everyone was devastated, our sons, our family. But Kate and Booking Health in general, they took control of all that once we got them the files. They gave us examples of the detail of the type of foils, because when we asked in country here for our foils, it was a case of what foils do you need, what specifics are we supposed to give you, because foils can be quite detailed. It was really just the surgical notes. It was the key information. So it was very positive and very good, and we'll be forever grateful to Booking Health and to Kate as well.
Yeah, she was very clearly communicating, because I could hear the conversations, and she was very efficient, and she was ringing back kind of basically on a daily basis leading up to us traveling to Germany.
And our interpreter, actually, or the person who supported us in country when we got to Germany, was a lady called Claudia. She did a super job for us as well. So our main contact was Kate. In country was Claudia, and both of them, like, it was just very, very professional, very good. They kind of normally, like, together, were professional people, you know, reasonably smart, and were reasonably able to function well as people in our lives. But when we got the diagnosis, we kind of fell apart, you could say. It was terrible. So they really took the weight from us and carried, they kind of carried us really up to get the treatment done with Professor Gonzoghi. But Booking Health in general, it's been excellent. Like, really, you couldn't ask. It's very obvious that they're dealing with a lot of sick people all the time, similar to ourselves in the situation Daria's in. So they know how to handle it, and they're well trained, and they're very precise and very clear with the information that they needed from us, which made a huge difference. And when we got to Germany, there was a lot of contact on the way when we were driving and sailing in the ship to get to mainland Europe from Ireland, which is an island, obviously. There was constant contact, and it was like regular updates. It was almost kind of coaching us to keep us going, probably mentally, make sure that everything's on track and that everything is okay. Yeah. So we were very, very grateful for that, and we always will be. Yeah.
Just one thing I forgot to mention, which was probably very important with the whole dendritic cells treatment. There was definitely an anti-aging effect to the treatment, because I was nearly 51 years of age. I'm 51 now, and definitely my husband has commented that I look fresher and younger.
I think actually what's important, that's actually a good point.
Yeah.
When you read the science behind dendritic cell treatment, there is one element which is very specific, and that is around the anti-aging element of the treatment itself. So when we returned from Germany, having Daria completed the dendritic cell treatment, the first thing I noticed after about maybe 2 months, maybe 2 to 3 months, I noticed a very, very obvious kind of de-aging. Daria looked, considering that she was in the middle of chemotherapy, in the middle of radiotherapy, that she'd had serious brain surgery with a craniotomy and everything that we've been through. She looked remarkably fresh, and it was de-aged. She genuinely had de-aged. I'm her husband, and I know her for 25 years. And I could definitely see an anti-aging effect. There's no question about that. And again, when I noticed that, it was then I realized that the dendritic cell treatment was working, because that was one of the elements of the treatment that we had read about and that we had discussed at the clinic as well. Now, obviously, the anti-aging was totally irrelevant, and that's not why we were there, obviously. But I noticed the anti-aging, the de-aging, the freshness, considering what she had been going through. I was a complete wreck at the time, and she was looking like, 10, 15 years younger. And I understood that it was the dendritic cell treatment, but obviously it's not the most important thing, but it definitely is. When I realized that this treatment is working, something was going on within her system and her body that was helping the de-aging.
At least there is something positive.
Something positive
in the whole, journey.
For us, I think what was really, really important is that when we got to Germany and we arrived at LDG laboratories with Professor Gonzoghi, it was a very, very positive experience. The professor himself is a fantastic person, has fantastic communication skills, was very honest, was very open, and I think we knew straight away that we were dealing with somebody who was an absolute expert and professional. Everything, you know, it was about science. It was about helping us, and we got such a great positive vibe from the doctor. It was just totally professional, very nice, a lot of empathy, a lot of words of encouragement. And a lot of discussion around the realities. There was no false promises. There was no, you know, discussions that would give us false hope. There was nothing like that. It was very honest, very open. But we came away from the place following the treatment, and the professor spent actually quite a bit of time with us, which we really appreciated. And that gave us great moral support. And then the science behind the dendritic cell treatment. And now, looking back in hindsight, when we look back from today and retrospectively look back to then, everything that we read and everything that we were informed about, every single item has actually come to pass, luckily, like really luckily for us and for Darius. So a very honest, a very positive experience with Professor Gonzogi at his clinic with all his staff. It was amazing. Yeah.
Yeah, it's the confidence and the kind of the expertise and the warmth and the personal skills as well. And he was just a very nice, warm person as well.
And we didn't like it. It's like when you look at the science of immunotherapy and you look at and we've read extensively on this now. Like we've been reading and studying this extensively since. Professor Gonzogi and the team, the medical doctors and his medical board of directors that they have at the clinic, these are the world's leading experts in the field of immunotherapy, dendritic cell treatment. They really are. So we were very fortunate, number one, that we found Booking Health. Number two, that Daria was accepted to the clinic and that Professor Gonzogi's clinic accepted her. Number three, that we were able to get to Germany and travel to Germany. And I guess number four was that the treatment was completed. And now I guess today it's just a very positive story so far for us.
When I first heard glioblastoma, the only association I could make was, oh, I heard about this famous person and that famous person, and they all died from glioblastoma, no matter how much money they had. And what people, I think, need to hear are positive kind of stories and hope and that they could open if they research about this disease or about new treatments for glioblastoma. They can hear something positive from ordinary people like us.
And one of the questions that we would get from people commonly was, if the treatment is so good and it's so effective, why is it not available in your own country or other countries around the world? And I guess it's only our understanding from studying it and researching this is that, number one, with respects to glioblastoma, the science of the live culture process and what Professor Gonzogi and the team have developed, this is very, very new, like really new. You know, like all new medications, you know, sometimes an illness can be a major problem. A medication comes on the market and then it's not a problem, but it's a new technique. It's very, very personalized. It's a very personalized treatment. It can be quite expensive as well. So that's a reality, okay? But countries are not ready for, number one, the expense of something like this. It's a very personalized treatment. So, you know, national health agencies are not going to have this treatment on board. Not now anyway. Maybe in the future they may have, when there's huge amounts of data and all the success stories like Daria and other patients are published and it comes to the fore. But you have to seek this out yourself. We'd say to anybody who's struggling and suffering now with the stress and the trauma of probably a recent diagnosis. We would say go as quickly as you can and get the dendritic cell treatment done. Do it immediately. Try not to wait post chemotherapy, radiotherapy. Seemingly it's effective at all stages, but you don't give up, don't fall apart. We didn't. We reached out, and we've got great results as a result of that. So don't fall apart. You need to. It's an aggressive disease, and you need to fight it. And the only way that you can fight it is by applying the best medical science and treatments against it. We did that with Professor Gonzoghi and his clinic in Germany, and it was luckily for us, it's the best thing that we could have done, and we did it. So just for people not to give up, and to reach out and be open-minded, and you know, there are treatments out there for people to get. Like there are treatments there, but you have to seek them out yourself. You're not going to get recommended by your own in-country medical provider, your own state medical or your private health insurance. They're not going to tell you about dendritic cell treatment and go to Germany and do this. You're going to have to find it yourself, and you need to be resourceful, and you need to be very strong and very, very determined. And when you have those characteristics, and if you dig deep as people and as families, the treatment is there. You have to pay for it, which is the reality of life, but it's there, and you'll be well looked after. We were very well looked after with Booking Health, and we would highly recommend Booking Health to anybody, and specifically with dendritic cell treatment for glioblastoma, Professor Gonzoghi, an amazing clinic, an amazing person, and an amazing results, which is the most important thing. It's all about results.
And it's great that it's also complementary to other treatments like radiotherapy and chemotherapy. So one doesn't exclude the other. It can be combined. And I suppose the more you can, like Professor Gonzalez told us, it's like an army trying to defend, to fight the disease, consistent of infantry and planes.
So, like seemingly you need all the elements. So it's not good enough just to do dendritic cell treatment and not do the standard treatments. The dendritic cell treatment is one element in the fight against the cancer. Your standard treatment like radiotherapy, chemotherapy, together as a combination, they're very effective. They've been very effective for Daria. So it's about being early. When you are diagnosed, you have your surgical procedures carried out. It's about getting to the clinic via Booking Health, getting your medical files quickly. Everything's quickly, because traditionally you start your chemotherapy, radiotherapy within 6 weeks of having your surgical resection, surgical operation procedure. So you really have a short window. There's a very narrow window of only about 6 weeks, which we were under pressure to meet at the start when we were going to Germany. So you have to go and get the radiotherapy, chemotherapy done traditionally within 6 weeks. So we only had that period to have the surgery, get to Germany, get to the clinic, complete the dendritic cell treatment. It took about 8 days in total. It was very easy. There was no major complications. Daria didn't have to stay in hospital during that period. It was a case of the blood was extracted. There was assessments. The blood went to the laboratory. The vaccine was prepared, and it was reintroduced 8 days later with a good set of bloods and with the infusion of specific vitamins and that type of thing. So it was.
I just had to mind myself to make sure I wouldn't get some cold or infection that would, cause fever or something. Yeah. So, and throughout the treatment in general, I had to try and stay out of public places as much as I could.
Yeah, I think the reality, something that wasn't explained to us very well back at home, was when you undergo radiotherapy, chemotherapy especially, you're really at risk during that period to infections. And one of the serious infections can lead to sepsis. And people who have glioblastoma, who get the surgical resection, who complete dendritic cell treatment, they complete the chemotherapy, radiotherapy, that there is a risk of infection due to the chemotherapy element of it. And people need to be very careful. Any elevated temperatures, you need to go quickly to your local hospital. We were always very quick acting. Any sign of any temperature, any sign of anything, we got that. And we were lucky that we did that actually during the summer months when Daria had an infection. We were lucky that we moved quickly. So it's about, you have an aggressive disease, you're very vulnerable, you have to be very alert. You have to be very aware and move quickly to the hospitals in your own country if you do get any temperature, things like that. We hope to tell other people with our words that might help them. And that's the reason we do this. So it's just to help. We don't like being on camera, and we don't like we're busy people in general in our lives, but like we're not into like showing ourselves on the internet, and we don't have social media accounts where we want to like it's not yeah. So it's for us is just to get the message to other people that if they do come on your website, when they find about the information and there's a link to a video where there's real people from different countries who said we had glioblastoma multiforme, we were told 12 months, 15 months to live, we were devastated. You know, they can resonate with this information and then go, look, nearly 1 year later, no cancer, anti-aging, and it's real. And we just want to tell people this, and that's it, isn't it?
We obviously, some people probably don't want to do it because they think, oh, it's too early to be happy because now I have to do the scans every 3 months and it might go for years. But I suppose at this stage, I just think whatever is meant to be is meant to be, and you just have to try and enjoy what you have right now and help other people if you can in that sense.